Guys, welcome back to Medical Coding with Blue. Today's episode is all about, is medical coding hard to learn? If you are brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay, guys. So last night I did a live episode and I was asking the audience for questions. Two people asked nearly the most identical question, which was, what is the hardest part about being a medical coder? Now, this question can be interpreted in a broad way, right? What is the hardest part of being a medical coder? But both of them are considering getting into the medical billing and coding field. So they're doing their research. And to me, that means, is this difficult to learn? What all is going to go into this? So that's what I'm going to address today. My channel is filled with lots and lots and lots of advice for new people, even advice for veteran coders who are out there in the world. And if you just take the time to just go through, I try to be as specific as I can in the title about what I'm talking about, but take the time to go through and look through my videos because that will really help you. But I'm going to talk today about what you should know when you're trying to learn this, or when you're trying to think about getting into this. Now, this career field, health information, medical coding, medical billing and coding, is open to a lot of different people. All walks of life get into this at almost every single age range. Whether you are just out of high school, whether you are in your 50s and your kids are out of the house and you have empty nest syndrome and you want to do something else different with yourself now that you have the time to learn, it welcomes those people as well. In your 60s and you're bored and you don't want to just do nothing, you want to learn medical billing and coding. I have plenty of people that are in their 60s that are learning this. If you are younger and you're in your 40s and you think, I can't possibly start a new career, Blue. Oh, yes, you can. Trust me, I see it every single day with my audience. My audience is people from all ages and stages of life, okay? So it welcomes anybody and everybody. Don't ever think that you're too old. Age really is just a number. And before you think, well, I'm going to be discriminated against, there's laws to protect against age discrimination. So don't even worry about that if that's what you're occupying your mind with, because that turns into like a self-sabotage where you're just thinking of all the ways that this isn't going to work. Think about all the ways that it is going to work and the reasons that you are choosing this career field. Now, I will caution you guys on a few things, because the schools, again, they like to dangle these things. High starting salaries. Guys, you can go to the Department of Labor or the Bureau of Statistics and you can type in, the starting salary for a medical coder or a medical biller, and it will tell you specifically in your area. Please do not ask me to leave you the link, because I won't, because this is part of your research. Every place in the United States pays differently for medical coders, okay? It's based on experience. It is based on whether it is a state hospital, a public hospital, a private hospital, a government hospital. There's lots of different variables that go into it. This is the one channel that you will run across about this career field that I will never speak in dollars about how much medical coders make, because that's how the schools sell the field. I am not here to sell the field. What I am here to do is to tell you the reality of the situation. Medical coding does pay very well, but everybody has a different definition of what very well means. And some people are just very impatient and they want the large dollars right away. If you're thinking about the perfect business model, you're going to know that you're not going to pay somebody who's just barely starting out with no experience and is going to make mistakes in the beginning. You're not going to pay them on the high end of the pay scale, because why? They're still learning. So it's important to know that you're going to work your way up. Now, I had 2 pay changes in the first year that I started, okay? I started off at a temp agency, and that was how I got my first job. And a lot of people don't want to do that, but it's something that you may have to do. And a temp job is not a forever job. It's just meant to get you some experience and get your foot in the door, and you are not working for free, all right? Because a lot of people think, oh yes, you need to volunteer. No, you do not. No, you do not. You never, ever volunteer. Not in an industry that is worth what this is worth. This is worth a lot of money, and these organizations make millions and millions of dollars. Some organizations make billions of dollars in a year. So there is no excuse for not being able to pay their employees, okay? And that's just something that you got to know there. Now, the thing about this is when you're getting into this and you're just trying to say, okay, well, you know, I'm okay with starting out at a facility, but my goal is to work remotely. That is fine if you know that you need to start at a place first. Now, the reason that I'm very adamant about new medical coders starting out at a facility is because you need that camaraderie and that time around other people. Because yes, learning medical coding is difficult, and it is not for the faint of heart. It is not for those with a weak stomach. If you look at it, right, where you're working in the book has all of the most perfect scenarios. It's got all of the information that you need, and there is nothing that is missing. When you get out in the real world, you're going to be dealing with real life doctors, right? Real life doctors that they're going to have good days and they're going to have their bad days. They all have lives outside of the facility, out of the hospital. And there's times when, you know, they're preoccupied and they've got other things on their mind. The last thing they want to do is have to document. And so they're going to rush through. Sometimes they're going to miss things, and you're going to have to query them. You're going to have to query them. You're going to have to query them. And you're going to have to make sure that they, you know, update their documentation so that you can code and get the claim submitted and that kind of thing. So there's a lot of things that go into it, which is why being brand new and working in a facility where you have exposure to other coders is very important. Now, yes, the East Coast and the West Coast, they both have this thing where there's not a lot of space in these facilities sometimes. And so their workers are 100% remote. And if that's the situation that you're in, that's the situation that you're in, okay? But what I'm saying is not everybody's like this. So don't just automatically just pursue those types of jobs, okay? Because again, you are making it more difficult for yourself, because you're going to see that when you go from the book to the real world, that documentation is going to look so different from what you're used to, okay? So just take your time to be able to do those things. Now, like I said at the beginning, it is a lot that you have to learn. And if you know to pace yourself while you're learning, and say you're going through a good sized program, which is 9 months, 12 months, or 18 months, that's about as long as you need to really learn. And AAPC has their online program, which when combined with because they have the anatomy and medical terminology separate from the coding part, but when you add them together, it comes out to 8 months. 8 months is still fine, okay? But I just say 9 months, 12 months, or 18 months. But if you're at an 8-month program, it's totally fine. You can still take additional time to study, but you're going to be learning a lot of things like medical terminology, anatomy, and pathophysiology. These are things that cannot be skipped when you are learning medical coding. I have heard of some instructors saying, oh yes, no, you can learn it on the job. They'll train you on the job. No, they won't. They will expect you to already know at least your basics. And how do you learn the basics of medical terminology? At least you learn your prefixes, your suffixes, and your root words. That way you can piece together words, and it's not so difficult, all right? And you'll be still continuing to build your medical terminology throughout your career. Again, 16-year veteran, and I'm still building my medical terminology. But it's important that you at least know that. You at least study your prefixes, your suffixes, and your root words. Why is pathophysiology important? Because pathophysiology is the study of the disease process. And when you know kind of like what the symptoms are of certain conditions, it makes it a lot better. You're not going to be caught up in coding for symptoms when you have a definitive diagnosis, because you're going to know that those symptoms are a part of that definitive diagnosis. And there's a lot of different things, again, that you're going to learn when you learn pathophysiology. There's a ton of workbooks out there that can help you. And all you need to do is just get through a workbook just once, because that's going to lay the foundation. And when you get done with your studies and everything, you know, at the end of your program and you take your certification exam and you're out there applying, that's when you can really kind of drill down to, okay, well, I'm applying for the emergency department. So I know I'm going to have to beef up on my hydration. How do I code for hydration? How do I code for, you know, injuries and fractures and things like that? So those are the things that you're going to be looking at in those types of situations. And that's where it gets easier, right? Because then you can kind of like, okay, this is what I need to study. This is what I need to go over. And it's not going to be so many things all at once. But what happens is a lot of times is that people, when they first get into this, they get so excited. They get their books, they start tabbing them up, they start writing and highlighting and doing all these things to these books, right? Their coding manuals. And then they're just like, oh my gosh, this is so much and I can't do it and I just give up. First of all, you should never be tabbing, writing, or highlighting your books. Why? Because your coding manuals already have all of the information that you need to be able to find the code. You just have to practice using the book. You can absolutely learn to use the books without the tabs. And that's what I have done from the very beginning of my career when I sat for my CCA. That's the Certified Coding Associate. I had that for 13 years because I stubbornly held on to it. But back in the day, you could not have any tabs on your books at all. AHEMA was very strict about that. Now they say that if the tabs come with the book, that you can use the tabs, right? So the CPT manual, the AMA CPT Professional Edition that we all have to have as coders taking a test, and you can see it in the back there, it has its own set of tabs. So you can absolutely use those tabs if you need to. Me personally, I still say no. People ask me all the time for a video demonstrating that, and when you get 100 requests for the same thing, you give in, right? Okay, go ahead, I'll give you this. And then I got people, I can't believe you tabbed it, Blue. You always say not to tab. Okay, yes, I did, but there's people that ask me for it. And if you're going to do it, I feel like you should at least do it right, you know? But again, if you're practicing with the book, all the tabs will do is get in your way, all right? You do not need to do circling. You do not need to do highlighting in your CPT book as well. Because again, if you can't notice an indentation to the next code, really, what are you even doing? How are you learning? All right. So all you have to do is when you're learning, just pace yourself and take your time and go through these things one at a time. All right. And devote the time to it. This is the other difficult part for a lot of people is that they can't seem to carve out 20 hours per week. No, Blue, I have a full-time job. I've got a family, and all I've been doing is studying 1 hour or 5 hours per week, and I can't figure out why I can't pass the exam. Because you're not putting in enough time. So when you are studying, you need to be putting 20 hours per week. How do you get to 20 hours per week, Blue? Half an hour in the morning, a half an hour at lunchtime, half an hour on your way home if you're driving. You can be listening to something, right? Minimum of 30 minutes, right? Then you get home, you cook dinner, you do all the things that you got to do, and then you study for 1 hour, meaning that you're going through the workbook and working through the word problems and looking up the codes and things like that. You take a break after that hour, and then 15 minutes, 30 minutes, whatever, and then you come back, and then you do a final hour in the evening, and that's 3.5 hours that you've done in one day. Now you do that for 5 days, that's 17.5 hours that you will have put into studying, right? And so all you need is 2.5 hours on the weekend. On a Saturday or Sunday, get those 2.5 hours in, boom. You got all of the time done for the week. And then you do it again the following week, right? And then you keep doing that. Because the person who is doing it this way, where they're doing 20 hours per week, they're getting a minimum of 80 hours in a month of study time, versus the person who's dragging their feet, making excuses, complaining that it's so hard, they're not even spending time with it, and they get 20 hours in a week. That person who has 60 more hours done in the month is going to be a lot more confident than the person who's wasting all that time complaining and barely doing 20 hours in a month. Okay, So that's how you do it. And then you do that consistently throughout your program, and you're going to be ready for that test as soon as you get done. And by the time you know it, 9 months, 12 months, or 18 months flies. Trust me. There is no better way to prepare yourself for this industry than to do it this way. And if life gets in your way and there's a lot of things going on at the time, and you just couldn't get the total time, the 20 hours in, but you got at least 15 in, that's okay. Take that and just move on and just try to, catch up for the next week. You don't have to tack on another 5 hours, but you do have to try to make that 20 hours be consistent. And getting to that discipline of getting those 20 hours in every week, that's going to do another thing to remodel yourself. It is going to make you a lot better and a lot stronger as a medical coder than you would have ever expected. Because the people who are undisciplined, who can't do that, who just want the money, who just want to work at home, who just want to, I want to travel and do medical coding. No. Why? Because when you have access to these electronic health records, you have all of these people's private information. There are laws that protect this information. Therefore, you cannot be out there willy-nilly with your laptop and trying to connect to Wi-Fi or trying to do all of these things and trying to code while you're at the beach. That does not work. Why? Because you are not in a secure area to keep that information safe. Somebody can walk up behind you and look at your screen and you just committed a HIPAA violation. So would you like your private health information out there willy-nilly for somebody to see because they're so focused on having their way? I'm going to travel and I'm going to do this and no, that's not the way that it works. And I don't know why people think that that's okay and that's appropriate, because it's not. So if that's something that you want to do, if you want to travel and work at the beach, there's other professions that you can pursue. Okay? I'm just being real with you. There are other professions that you can pursue. You should not do this if that's what you want to do. Okay? And the only reason that I'm saying that is because it's such an investment in your time, your energy, and your money in order to be able to do this and do it the appropriate way so that you can start making that really good money that you want to. Because even though everybody asks for 3 to 5 years of experience, and I always say this, and there's still people that just ask the same question, 3 to 5 years experience, you still apply anyway. Why? Because if there are happy coders in the area, they are going to stay where they are at. The employer will not have a choice but to look at the people who are applying. So even if you don't meet the 3 to 5 years experience, but you still meet the fact on your resume that you're saying that you have ICD-10-CM, ICD-10-PCS if you were trained in that, CPT, HCPCS, medical terminology, anatomy, and pathophysiology, if you have all of those things on your resume, because those are your skills, even though you haven't had a job in coding yet, if you have those on your resume, that's what the employer is looking for. Now, if you show that you're lazy, and by lazy, I mean that you're putting on, I have ICD-10 experience. No, ICD-10 knowledge. No. Why? Because there's two, ICD-10-CM and ICD-10-PCS. And medical coding is all about details. If you are not detail-oriented, and somebody who says, yes, I'm detail-oriented, but then they're abbreviating things and, putting weird things on their resume, or they have whole paragraphs, in their resume, no one has time for all of that. Okay, guys, no one has time for all of that. So again, there is a lot. There's a lot. I can never talk about the coding part without bringing up that part, because that's the part that worries a lot of people, is being able to get that job after they get done with all of that. It is possible, but this industry does not move fast. It does not move fast. If that's not something that you're down with, again, there's other professions that you can pursue out there. But I will say this job is not going anywhere, because we have to be able to critically think, all right? And for all of you that say, but AI cannot critically think. Okay? It cannot critically think. And because it cannot critically think, it's always going to make errors. It is always going to make errors. It is not going anywhere, no matter what anybody tells you. Because they were saying this when I started. They were saying this back when I started, when I very first started. And again, if I had to listen to all that, I wouldn't be 16 years into my career where I'm really enjoying what I do. And they say if you love what you do, you never work a day in your life. I feel like I have not worked since 2014. 2014 was my aha year when I finally understood that this wasn't just a job, this was a career. There is a difference between having a job and having a career. Again, if you are just looking through life just to see how much money can I get, how much money can I get, and you're motivated only by money, you're always going to be chasing money. Okay? And this is not the field that you want to pursue, again, if you're going to be chasing money. Because while it does pay well, you have to be focused on what your skills are and your skill building. So if you are not studying your medical terminology, if you're not continuing to practice looking up codes when you're out there looking for a job, because the job process may be a few months long, okay? If you are not still practicing, you're going to lose your skill. And when you start losing your skill and then you start applying for these jobs and then you're still applying a year later and then they're calling you back and they're going to give you an assessment test, you would not believe how many emails that I get from people panicking because they say, well, Blue, I've been looking for a whole year, but I got my certification last year and I stopped studying and now I don't know what to do. So then why were you still applying if you stopped studying? I give you guys real deal information here. And I am very direct when I ask you these questions, because a lot of times what happens is people get coddled, and then when the big bad world comes along, they don't know how to handle it. I'm trying to get y'all to be able to handle it before you get out there in the real world and you're really shocked. Or before you get into this program and you say, oh my gosh, was this what I got into? Yes, this is what you're going to get into. This is what you're going to come up against. And trust me, what I give you guys is nothing compared to what you get on the outside, what you could potentially run into on the outside. Because these doctors have different attitudes and different frames of mind when it comes to coders. And your veteran coders also have a different way of communicating with each other too. You know, there's going to be veteran coders that are going to be happy to help you. There's going to be veteran coders that will look at you and say, you know what? No one helped me, so I'm not helping you. You got to learn. And they will not help you at all. So if, again, this is not a bad career field, it is a very good career field, but you have to be willing to bring your ability to research. You have to have a thick skin. You have to be disciplined, and you build that discipline while you are in school, and that discipline will carry you a long ways. And it will give you opportunities that you never even thought of. You never ever think of all of the wonderful and great things that can happen to you until you get into this career field. I have had many, many wonderful experiences. And in October, when it is going to be conference for the American Health Information Management Association, I am going to be one of the speakers. This will be my first year as a speaker for an AHIMA conference, and I am very excited about this. And it is going to be best practices for performing provider education. Again, I'm over the moon for this opportunity. But this is not the only opportunity that I've had with AHIMA. So this is just a little collection of opportunities that I've had. So, or this is part of a collection of opportunities that I've had. So this is wonderful. To me, this is really great. And there's just so much to this career field that I love. Okay. And like I said, you can enjoy your career as long as you're willing to invest yourself into it. If you are not, and you want everything, what you want in your way, and you want it now, and you want all these things, you want to be able to do all of these things, and oh yes, well my neighbor does this and she does it at home, probably has experience, probably has been around for a few years in this industry. Okay. And again, if you don't cheat yourself out of the experiences of working at a facility first and then working at home, getting that one-to-one training with somebody who's actually a coder, right? And not somebody who is just a nurse pretending to be a coder, thinking that they know and trying to tell you all of these things about coding when they have no idea, right? Or somebody else, some surgical tech who says that they know and they don't know. You have to be careful about who you listen to information from, right? And for me, I have no dog in the fight. If you want to do this, fantastic. But these are just some of the things you got to know. It is difficult. It is a lot. It's not easy, but it will reward you. It will reward you. But that's the only thing. You just have to stick with it. And if you have a weak stomach, if you're impatient and you don't have discipline, this is probably not the field for you. All right. And I say this to save you from investing into something that you may not even like. Okay. But if you stick with it and you forge ahead, you're going to be just fine. You're going to be just fine, but you got to stick with it. Pay attention to the advice that I give. Look through my videos. Take a look on the internet. Just let your fingers do the walking, you know, and you'll see the information is out there, guys. So with that said, I'm going to go ahead and wrap this one up. Thank you guys so much for joining me. Have a safe and happy 4th of July, and I will see y'all next time. Bye.